We formed Sonnest earlier this summer to commercialize Electrast, which is a voltage-activated imaging agent for myocardial perfusion imaging, to address the question of that cardiologists face millions of times a year, which is my patient at risk for or actually having a heart attack? The current evaluation methodologies there are time-intensive, require ionizing radiation, and expensive centralized equipment. And so what we're doing is developing a technology to help the tens of millions of patients every year who exhibit symptoms of shortness of breath or chest pain and require functional or anatomic testing. The problem today is that doctors can't see blood flow or the lack thereof through the capillaries in the heart muscle, and no current method today allows clinicians to evaluate myocardial perfusion at the bedside in real time. So we've developed a strong cross-functional team to commercialize this technology that includes 2 cardiologists and 3 chemical engineers out of Drexel University, and a business team of 3 professionals who have worked together for over 10 years, and collectively have secured significant dilutive and non-dilutive funding and sold multiple companies. In the interest of time, I'm not going to go through the entire team, but here you can see the clinical and engineering team. And the management team, as I mentioned, have worked together on and off since 2005, most recently at Harpoon Medical, where we formed the company, raised $6.5 million of dilutive capital, advanced the technology into the clinic, and sold it to Edwards Lifesciences for $100 million, generating 100% IRR for our investors. And hopefully we can do something similar this time around. So at its simplest, what we're developing is an ultrasound contrast agent that goes into the body dark. And the way they do that is that they take a perfluorocarbon, a liquid droplet of perfluorocarbon, and they encapsulate it in a phospholipid shell. And in the presence of an electrical signal, that phospholipid shell depolarizes, and the liquid turns into a gas, creating an ultrasonic signal. Here on the, left-hand side for you guys, you can see Definity, one of the currently approved ultrasound agents in a pig. And it lights up anything where the blood is. So everything gets very, very bright. The problem is, what you want to be able to identify is what's happening in the myocardium, and that's staying dark. In the middle, you can see just a standard ultrasound, and on the right, you can see the myocardium selectively enhanced with Electrast while the ventricle stays dark. That has some really significant characteristics, and one of the areas where that's particularly attractive is in assessing perfusion and potential for an infarct. So here you see 2 pictures from a swine study where with an LAD occlusion model where we went in, occluded the LAD. On the left-hand side, you can't tell the difference between the myocardium that's perfused and the myocardium that's infarcted. But on the right-hand side, you can clearly see where we've injected Electrast and differentiate. This is the echo clip from that, and as you scan in and out on the right-hand image, you can see the area that's being perfused versus the area that remains dark. This is our obligatory competitive assessment slide where we pick a bunch of characteristics and show how we're the only technology that can do these things and nobody else can. But in all honesty, what we're really doing is, we're trying to develop an ultrasound-based myocardial perfusion imaging agent that will allow clinicians to examine patients either at the bedside or in the clinic without the need for ionizing radiation or expensive centralized technologies. A little bit on where we are and where we're going. We formed the company, as I mentioned, just a couple months ago. The technology was supported with generous support from the Coulter Foundation, which allowed the scientific and technical teams to develop this advanced prototype, which has been validated in large animal studies. The company is formed, we developed a team and licensed a robust portfolio of IP from Drexel. We've raised a small pre-seed round from internal pre-seed round, and we'll be going out to do our first outside round in early 2020, Q1 of 2020, and hope to advance the molecule into the clinic by early 2021. So in summary, as I said, no cardiac imaging agent can image the blood flow through the cardiac muscle in real time. In 2010, there were over 10 million Medicare-based imaging tests that would benefit for Electrest, and that obviously doesn't capture anything having to do with private insurance or outside the United States, so it's a large unmet clinical need. And Electrest is a simple, cost-effective solution. It's an injectable liquid with all FDA-approved materials. It's activated by the heart's own electrical signals. It's visible with the current clinical ultrasound technologies that are available everywhere, so no new technology needed. And the technology was validated most recently at NAMSA in Minneapolis at the end of 2018 by an outside lab. The initial indication focused on perfusion in patients presenting with undiagnosed chest pain is, we estimated, a $2 billion market, and as we branch out, we can go from there.